In 2017, more than 700 people in our state died from opioid overdoses, and almost 10,000 have died since the year 2000. Countless others have become addicted. Most people who get opioid medications for pain use them as prescribed without any negative consequences, but many others are at risk for misuse, developing dependence, or for opiate use disorder, referred to as addiction. Based on these concerns, Governor Jay Inslee called opiate addiction a devastating and life-threatening medical condition, and directed state agencies to develop strategies that allow for the safe treatment of pain while reducing the dangers of opioid misuse. At the same time, the legislature called for changes to prescribing guidelines. After a year hearing from patients and medical professionals, a task force created a framework of new rules for medical professionals who prescribe opioids. The new rules must be approved and in use by the end of 2018. The rules cover pain from injuries, surgeries, long-standing health conditions, and other medical situations. They do not affect medication for pain from cancer.
I require opioid medication for quality of life. I have a lot of other things I implement, my exercise, my chiropractor, my swimming, and all these things, but still at the same time I need this medication to be able to function, to get here today, to raise my son, to be part of society. I'm finding solutions to the complex crisis of addiction and overdose takes a balanced approach, and I really believe that the Washington prescribing rules have captured that.
People need to be aware that if they are told that they cannot have access to a pain medication because the new rules don't allow it, that's not true. We were greatly relieved from the beginning of the process to the end to see the level of awareness amongst the task force members, and that was reflected in the final rule setter.
The rules require prescribers to check the state database before prescribing opiates to see all other opiates and controlled substance prescriptions a patient has. The rules set guidelines for slowly reducing the amount of opioids taken by patients who have been on high doses of opioids to treat long-term pain.
Know that people are aware of the plight of chronic pain patients and are doing their best to ensure that these challenges are addressed going forward.
Healthcare providers, insurance companies, and medical practices can make their own policies about prescribing opiates to their patients, as long as their prescribing actions are within the state's rules. To find out more about the new rules and the resources available, please visit doh.wa.gov/pain. If you have specific questions or concerns about your own situation, ask your healthcare professional, doctor, insurance provider, or a patient advocate.